Hello, Flip the Pharmacy coaches and pharmacy staff. My name is Brooke Kalusic, and I am a third-year student pharmacist at the University of Pittsburgh School of Pharmacy. Today, I'm going to summarize the Flip the Pharmacy change package for October 2020. The goals of this presentation are to really just take the contents of the lengthy Flip the Pharmacy change package for the month of October and put them into a format that is easy for you to read quickly and share with your pharmacy team members. This change package is very comprehensive and includes so many great tips and resources, but for now we're just going to hit the highlights, review some tangible action steps for your pharmacy, and connect you to some valuable supplemental resources that will really enhance your pharmacy's practice this month as we enter a new domain. It's hard to believe we have already reached Domain 6 in Progression 2 for the month of October. Here's our roadmap just to give you a better idea of where we currently are at in the program. This month, we are focusing largely on optimizing the way we use technology and refining how we document opioid-related encounters in the eCare plan. There is a major emphasis this month on expressing the value of pharmacist services as the business model continues to develop. We want to better understand the data we are generating through these patient encounters so we can find opportunities to target various patient populations. I was able to condense the change package down into two major focus points, and we'll dive into each one in greater detail, but let's start with number 1, which focuses on the importance of looking at a patient's whole picture, giving particular consideration to the social determinants of health that influence opioid choices. The change package does a great job of outlining the steps necessary to identify patients in the pharmacy that we could call exceptions. And that could look a variety of ways. For example, maybe the patient's claim was rejected, or their morphine milligram equivalent just looks a little high to you, or maybe the patient simply cannot afford their prescription. Whatever the reason, it's important to engage these patients in a non-confrontational, peer-to-peer conversation to triage how the patient is doing and refer them to the appropriate destination. With more information, you and your pharmacy team can work with the patient to create an individualized plan based on their access to local services or support systems and the personal goals that they have set for themselves. One other point I want to note is that it's actually very simple to document these sorts of encounters in the eCare plan. Since pharmacists' care planning includes social influences just as much as it does clinical documentation, our records should reflect that. I wanted to highlight this great resource from the Pharmacy Quality Alliance, known as the Opioid Core Measures. It is really important that we are aware of how our services are being measured and paid for. By having a good understanding of these health plan quality measures, it enables us to work within this complex system of metrics to highlight the values our pharmacies are bringing to the table. I encourage you to familiarize yourselves with the metrics because they are becoming increasingly adopted by Medicare and Medicaid plans, and once they are more broadly adopted, your pharmacy will just be ahead of the game. Let's move on to our second focus point this month, establishing an opioid tapering plan by building a therapeutic relationship with the patient. This month, there is a huge emphasis on cultivating the therapeutic relationship with the patient. We all know conversations around opioid medications are not easy conversations to have, but it is the right for the patient and the responsibility of the pharmacist. It's very important to engage not only the patient, but also their physician when developing an opioid tapering plan. We want to make sure that we are communicating openly and setting clear, attainable goals based on the patient's needs. We also want to make sure that social determinants of health are considered when making this plan. There are multiple supplemental resources on this that can be found in the accompanying Flip the Pharmacy Change Package Summary newsletter, as well as the October Change Package itself. There are two ways pharmacists can go about approaching the topic of opioid tapering with patients. The first is the proactive approach, where the patient is someone that you are familiar with and have built a relationship with, and in that case, your role as the pharmacist is to then seek opportunities to initiate those conversations about potentially tapering opioid use when you feel the timing is right. The other approach is the reactive approach, in which the pharmacist notices decreases in the patient's opioid dose and then builds upon this first step by looking for opportunities to initiate these conversations with the patient. Another great resource is this opioid tapering algorithm compiled by Dr. Sam Williams, past resident at Osterhaus Pharmacy. This is a great tool for initiating those conversations with patients, mapping out their tapering schedule, and managing acute withdrawal side effects. This month's eCare plan goal is to submit 25 opioid-related care plans with a focus on targeting patients who are potential tapering candidates. In addition to the medication dose decrease intervention, you can also document these encounters as pain medication reviews. In conclusion, here are some additional resources from Flip the Pharmacy referenced throughout today's video. I encourage you to take a look at some of these as well as the October change package. Be sure to check out the written and audio recording summaries of this change package as well, and if you do find these helpful, please let us know in the survey found on page 2 of the summary newsletter. I hope you found this video useful, and we wish you the best of luck at your pharmacy as you enter Domain 6. Thanks for watching.